Hi everyone, this is Jared from Made to Move Fitness, and I've put together a series of programs for at-home workouts. Because of everything that's going on now, it's a great time to launch a home-based program. So this first presentation is more of a guidelines for home-based exercise. You don't need much equipment or any at all. There's going to be a bunch of programs that go along with this program. So they all have different modules, and they're all total body workouts. There's a lot of misconceptions when it comes to exercise, that you need to do this muscle group, then that muscle group, and split up days. These are just total body workouts. So they kind of go along with the other presentations that I had set up before. And they're very simple, very easy to follow. There also are PDFs that go along with these programs. So they have a picture of the exercise, the name. A couple things they're not going to have are, when we get to free weights and things like that, the amount of weight you would be lifting. There'll be instructions on how many reps and sets you'd be doing, but in general, the weight that you would specifically lift would not be added to that. That'd be something you would want to set up yourself. But right now we're going to go through the home exercise guidelines, ways to set up your home exercise station to make it the most effective as you can, and different things like that. So let's get started. Okay, so first I'm going to look at is preparation. So having a home gym area, you want to have about a 10 by 10 square, so you can put your arms out to the side, raise up so you don't touch the ceiling, as much space as you can for this exercise program. A lot of this stuff doesn't require any or very minimal equipment. You also have a couple things, if you have equipment already, things you can do with that. But number one, we want to have a 10 by 10 space and set up an area where you might have to move stuff around a bit, but so it's kind of a set designated area, kind of like a home gym area. So that's what we're looking at doing, is developing that. So whether you have in your basement, living room, a spare room, anywhere where you can have it set up and ready to go. Having the proper clothing and footwear is very important. Now when it comes to proper clothing, typically you want stuff that's not restrictive. Things that are, shorts and a t-shirt, you're going to be doing this inside, even though it's the winter. That's not restrictive. There's other types of clothing you can wear that is like a compression type fit. Those things have their advantages as well, but you really want to make sure you have your, part of your equipment is actually the clothing and footwear you're going to wear. One thing I do like to recommend is doing certain exercises barefoot, especially if you're not dropping or holding heavy weights where you have the potential to drop on your feet. If you're doing bodyweight exercise, being your barefoot actually helps strengthen some of the muscles that our shoes take away. So if you have a big arch support in your sneakers, that sometimes weakens your arch. So if you're doing things that are going to be barefoot, a lot of times that's preferable. Now, in terms of footwear, there's a lot of different variations when it comes to footwear. I'm a big fan of what are called neutral soled shoes. So a neutral base, let's say this is going to be the footbed or the sole of your shoes. Old school shoes, if this is your heel, would be inclined like this. They have a real thick heel. Okay, and what that does is kind of pitches your body forward and creates different types of issues in your body. Knee issues, hip issues, back issues can be related to that incline. So it's almost like you're always on an incline or a decline going downhill. So a neutral base shoe, whether it's a shoe or sneaker, is going to be pretty flat from the front to the back. They've kind of been a big fad recently in the last couple of years. A lot of companies have reverted back to getting away from real thick heeled sneakers and shoes to going more flat. So flat or neutral shoes, they do provide protection from anything on the ground, a little bit of grip, but they're not really changing or changing the pitch of your foot. So a neutral bed sneaker or shoe actually does a lot to help with improving your posture and not having as much strain on your knees and low back. So that's one thing you might want to look for. I'll probably do another video more in depth on that because it gets pretty detailed. But in general, when it comes to footwear, try and wear things that are not worn out. A lot of people have sneakers they've had for 10 years or more. I've trained a lot of these people. And there's a certain, just like the tires on your car, if you look at the bottom of your sneaker, it wears away, just like treads on your car. So there's a certain point where that sneaker should be thrown out. And your feet inside also wear into the shoe, and a lot of the rubbers and things dry out and crack, and they're not as supportive. So if you get a newer pair of sneakers, only use them for exercise. So again, they're just like any other piece of equipment in your home gym. Only use them for exercise. A lot of people buy a new pair of sneakers and wear them everywhere. And what that does is basically wears them out earlier than they should. So really just use them for exercise. They'll last way longer, they'll support your feet way longer. And again, look for more of a neutral footbed sneaker, not the real thick heel. Okay, if we're looking at equipment, there's a couple things I'm going to list here as we go along, but nothing crazy. Really don't need much at all. Basically some light dumbbells, some resistance bands. If you have any cardio equipment at home, you can use that. If not, not a big deal. We can work around that. The other big thing is you need to have water with you. Have a water bottle with you. Drink that entire bottle, especially during the exercise. Kind of sip it, don't chug it. Otherwise you have too much water in your stomach as you're doing, especially the core things might be a bit tougher. Having a towel is also very important because you're going to be sweating. You don't want it to get in your eyes. Make sure you wipe that off as soon as you can. Having a clock or a phone or tablet, some way to see how long you're exercising, and or a lot of this programming revolves around what's called intervals, or work versus rest intervals. So that's something I use very effectively, and it's nice to kind of package your workout together so you know how long you've been exercising, how long your rest is, and how long until the end. Because a lot of people think they have to exercise for a very long time to get results, and that's not really true. So a lot of that revolves around apps and timing, but you can also use a clock with a second hand. That works fine. Just doesn't give you the notifications when to switch from work to rest. Visuals and entertainment work very well as well. Obviously having music while you're exercising does motivate you. If you are doing some type of cardio or watching TV or catching up on your shows, maybe watching something educational, you can do two things at once. You can multitask and do both those things at once. It's even a good thing if you are watching TV, do your entire workout in front of the TV. So if your home area is in front of your TV, that might stimulate you to do both at the same time instead of sitting and watching. That would work well together. Another big thing is having a mirror. Obviously you go to a lot of gyms and things and there's lots of mirrors. The reason for mirrors are several things. So number one, you can see your form and technique. Right? So as we're exercising, if you don't have a mirror, you don't really see how far you're going down, how your range of motion is. Those are things that mirrors do well for people. The second part is you can see yourself changing. Right? It's very motivational when you see yourself changing. Even though we see ourselves in the mirror every day, as you're changing, that process is very positive and motivating. So that's a big part of having a mirror in an exercise room. You can see your form and technique. Maybe if something is shifting too far left or right, or if you're not centered, those kind of things help a lot with form and technique. Okay, so if we're looking at floor space, again, a 10 by 10 square on average, unless you're real tall, should be enough room for you not to bump into things. You should have enough space so if you put your hands up, you're not touching the ceiling. I have a lot of clients that have workout areas in their basement with a low ceiling, so if that is the case, you could sit if you're doing any type of like pressing motion so you're not hitting the ceiling. But in general, you want to have it, the average room is 8 to 10 foot ceilings. That should be enough space for the average person to be pushing something overhead or reaching, so you're not going to be hitting your hands on the ceiling. Be aware of ceiling fans. A lot of people don't watch for them, and if they're spinning, you can hit your hands. You're not going to probably chop your fingers off, but you just want to be careful of that. So ceiling height is important, making sure you have enough space to reach up over your head, especially if you have a dumbbell or something in your hand. You don't want to be punching a hole in your ceiling. The type of flooring is, you can vary that. There's a lot of different types of flooring you can have. If you have carpeted flooring, obviously it's going to be a little more cushion. Hardwood is going to be, not as much give. Concrete is one big thing that most people obviously have in their basements, and some people have tiles over them. If you get the rubber tiles that you can put over the floor, like they kind of lock together, be very careful of those unless you have weight on them, because they will slip very easily on concrete floors. So be aware that your flooring is pretty secure, that there's nothing on the floor you can potentially step on. But in general, try to have something that is going to have a little bit of cushion, especially if you're barefoot, and not going to be too hard. I've seen in the winter floors can get very cold in the basement, so just be aware of that. Some of the things we'll be doing will be on the floor, so you want to have a mat, exercise mat or yoga mat, so it's a bit padded. And just try to set this area up so it's your home gym. It's just like going into another private gym. It's your home gym, so have it set up in that way. So flooring is a big thing. Make sure that it's devoted to exercise, right? So you have everything set up there. Things are not all strewn about. They're all in one place, because a lot of these exercises go from one to the next to the next. So there's not going to be a lot of time to go over here and get this and have everything here in one space, so you know what you have to do, you know what you need, and it's all in one space. Okay, so we'll go back to clothing here a bit. So comfortable and non-restrictive clothing obviously is best. And I talked about the neutral footwear or barefoot. But the main thing is have these things ready. Have your stuff ready and set out to the side. You have your sneakers, you have your, all your workout stuff ready to go for your workouts. It's also very important to schedule your workouts, especially nowadays because more people have home-based offices. Putting those workouts into your schedule is very, very important. So you have an appointment to make. So having all your stuff ready, just like you're getting ready for work, you have to bring X, Y, and Z to work. All this stuff is there and ready to go. You schedule your workouts into your day just like any other business appointment or private appointment. And obviously everyone's using apps and things like that. These are things that if you put it into your appointment book, they're a lot harder to just avoid, rather than saying, this is an appointment I have with myself, and I'm going to make that appointment. So try to prioritize and make sure that your health is top priority, because if you're not healthy or well, it's hard to take care of others if you are then their burden. So neutral footwear or barefoot. Towels keep the sweat out of your eyes. Wristbands actually work pretty well, or headbands, especially if you sweat a lot. Some people sweat profusely without doing much at all. And the reason for that is as you exercise, your body heats up quite a bit. Actually so much that if you didn't sweat, you can actually cook an egg on your skin as you're exercising. So the heat builds up pretty quickly when you're exercising, so be aware that certain people sweat more, certain people sweat less. Sweating is essential to your health. If you're dehydrated as you start to exercise, you might not sweat as much, but also that could create other issues. If you're sweating a lot and then you stop sweating, that could be some heat exhaustion. So you got to be careful of that and make sure you're hydrated. So that's a big thing we'll talk about, is hydration levels. Basically, if you were to put yourself on a scale before you exercised and then put yourself on a scale after you exercise, the amount of weight that you would lose is actually water weight. So this is something when I work with the Sabres and NHL guys, they would actually weigh them before practice and after practice and then determine how much water or hydration they need to replenish that. Because if you're dehydrated, a lot of your systems don't work well. You have more cramping, less energy, lots of problems if you're dehydrated. So one of the things to look at is as you're exercising, if you're sweating a lot, you need to be replenishing that. But replenish it during your workouts, little sips of water. Don't guzzle water. Try and sip it out, throughout your workout, and keep your mouth wet. Okay, so that's what goes into here, where we're talking about hydration and having a water bottle prepared and ready. Now, if you have any blood sugar issues, if you're hypoglycemic or hyperglycemic, diabetic, have anything like that, you probably want to have a little bit of sweetness in your water. So you can put a little bit of juice or something like that in. And what that does helps maintain your blood sugar during your workout. Now, the other thing that it does is when you flavor a drink, it actually makes you consume more of it. Most of the time when you're thirsty, you're dehydrated, but it's actually too late to hydrate because you already hit that thirst point. So when it comes to flavoring water or drinks and things like that, you put a little bit of flavor in it, it actually makes you consume more. All right? I'm not a big fan of a lot of sports drinks and things like that. They're mostly just sugar and water and other things. There are electrolytes in them which do help, especially if you're sweating a lot. But for the most part, just drink water, put a little bit of flavor or juice in it. There's these little squeeze things called Mayos. I would not recommend those things. They're all chemicals and artificial sweeteners. Just use plain old juice, whatever kind of juice you prefer, just a little bit, just to kind of sweeten it a bit, and that'll make you drink more during your workouts. Now what will happen as well is your blood sugar will drop as you're exercising, so that little extra carbohydrate will actually keep you up a bit so you won't get nauseous. Some people get headaches. Again, working at your own intensity level is very important, and making sure you're not overexerting yourself is essential to a successful workout, and one that you're going to actually enjoy and get a benefit from. The other thing is making sure that when you're drinking these things, make sure that you're having more throughout the day. So it's not just during your workout or afterwards. You're probably going to need more of that throughout the day. So make sure you're drinking, on average, each person needs about 64 fluid ounces of water a day. And you might be getting that through other sources like soups and things like that, other liquids you're consuming. But primarily you want to have fresh, clean water, about 64 ounces a day, especially in the winter because everything is very dry. Our skin gets dry in the winter. There's less humidity or limited to no humidity. So everything is kind of leaching water from us. When you're outside, you're going to see water vapor leaving. That's happening all the time, but especially a lot more in the winter because you can actually see it. But it's also happening more because of the dissipation of the water from your body. Okay, so again, we talked a little bit about entertainment and why mirrors are very important to check your form and your progress and see how you're changing over time. Full-length mirrors work very well, but even if you have a square mirror on the wall, based on the distance you are from that, you're still going to be able to see most of your body. So you don't need a full-length mirror or mirrors all over the walls, just like you would see at a gym. Just one mirror should be fine, and position that in the right way so you can see yourself. If you have two walls back and left to right or 90-degree angle, if you have one in front, one on the side, you can see your form from the side as well. So front view, side view, not essential, but it's a good thing to check your form because you can only see one angle. You might miss certain things that are incorrect. Again, watching a TV or a video or a movie or something on your phone, I prefer actually people listening to music. It's much more motivating. But again, you can multitask and catch up on a lot of different things while you're exercising. So it's a good time to do that. And with music, obviously, there's so many ways to set up your own personal playlists and different stations and just motivating things that personally get you motivated. I prefer using speakers versus headphones. Even though a lot of people today are using these AirPods and things like that don't have wires, those, if you tip over and move too fast, you might fall out and you step on it. I prefer just having a speaker or something in front of you instead of having headphones on, especially if they have a cord. I mean, it's very easy to yank that out, and people have all these different apparatus to hold their phones or devices. It's much easier to just have it, whether it's Bluetooth or anything like that, just have it away from you, especially if you drop your phone, you could crack the screen. Obviously, you don't want to drop anything on it. So I usually tell people to use a speaker versus using headphones, even if they're wireless. That's just usually a better way to do it. It's just much more free. Otherwise, it kind of locks you down. And if you have it on your arm, it's also going to be a little bit of excess weight on that one side, which might not seem like much, but when you're fatigued and you're trying to use your arms, that does matter. So that's one thing to look at when it comes to music. Equipment. You do not need much equipment, if any at all. The first two programs are total body weight circuits, so they don't require any equipment. Use your own body's gravity weight as resistance. So it's very simple. You don't need it much at all. A couple things I built into the later programs are going to be free weights, resistance bands. An exercise mat and an exercise ball are good, and a lot of people already have those. I'm going to show you different ways you can actually use those. If you don't have them, they're very inexpensive, especially like resistance bands kits that attach to doors or around, let's say you're in your basement, you have a support post. There's a lot of different things you can do with those that would mimic a real gym. So it doesn't have to be, universal piece of equipment, a bench, and all different cardio equipment. You don't really need all that stuff. takes up a lot of space, so what we want is more floor space. We don't want too much on the floor because you're going to be using as much of that space as possible. Exercise balls, well, a lot of people have these big physio balls or Swiss balls they were called. Those are great for a lot of exercise, and I'm going to have a program devoted to that as well. Optional things would be cardio equipment. A lot of people have home cardio equipment already, whether it's an exercise bike, a treadmill, an elliptical, a rower, a Stairmaster, whatever it is. Those can be obviously very useful. There's a lot of programs simply built into them. The main thing is you don't really need those, but if you have them, they're good to use. Rower is probably definitely my favorite. That's why I capitalize the entire word. Because they are basically working the muscles that are typically weak on most people. A lot of retraction in the rowing motion, so it strengthens your upper back and helps with posture. They also work a lot with your hamstrings, so you're pulling yourself in on the seat and glide. So rowers are probably, if you're ever going to buy a piece of exercise equipment for home, rowers are probably one of the best, plus a lot of them will stand up in the corners, so they're not taking up a lot of space. Whereas obviously a treadmill, some of them will fold up, but they're still pretty large. Bikes, some of them take up more space than others, and ellipticals typically don't fold, so they're pretty large devices. So again, we want more floor space, we don't want as much crowding. Alright, so technology-wise, there are tons of free apps out there that will do a ton of great things to keep you motivated, track your progress, and set goals. The main one I like to look at are using interval HIIT apps or Tabata timers. Okay, and what they do is they break your workouts down into time signatures. So it's work to rest, and it's going to basically give you signals, whether it's a sound or vibration or beep, that's going to tell you when to transition and shift. Now the programs that I've written go along with this type of program, this type of app, to where you're going to see what you need to do with a visual picture, and the timer is just going to keep rolling. So that's going to give you all your time signatures. You're going to know when you're close to being done, when you're done, how far you've gone, how much longer you have to complete the workout. There's a lot of really cool heart rate apps. So some of the apps, you actually just put your finger over the light on your phone and it'll actually give you your current heart rate. Some people are going to be using heart rate monitors with a chest strap. Some will have like a Fitbit on their wrist. And there's many ways to test your heart rate. But if you use the app, again, you just put your finger over the phone, the light on the phone, and it gives you a pretty accurate reading on that. And you can track your progress with a lot of different apps. There's no specific app I recommend because there's so many out there. But basically looking for an interval timer, a lot of them are going to be free with ads, which if you don't mind, they're not a big deal. You can also purchase them very inexpensively. But apps obviously are the way to go. Now if you are using a tablet or a laptop, you can use that as well. If you're using, there's websites which have the timers on them as well. So you don't necessarily have to have a smartphone or a tablet or a smartwatch. There are other ways if you want to go down the list of less technologically advanced things, and they all work well. Again, you can even use a clock, right? So if you have a clock with a second hand, you can use that for your intervals. It's the same exact thing. An app versus a clock on the wall are going to do the same things, just without the vibration or timer or the alarm changing. So again, there's a lot of different ways you can use technology to your advantage. We're going to talk also about weight management and measuring yourself and progress testing in a later video. But right now I want to kind of address how to set this up and how to have safe and effective home workouts. So if you look at motivation, some people approach things from a positive state of mind or point of view, and others from a negative, whatever motivates you. So in case A, you exercise because you love your body yourself. So that would be a positive thing, right? This is, I love my body, I love myself, and I want to take care of it. Something we have to do. And option B is you exercise because you don't like the way you currently look or feel, right? So that's it. You don't like this, it's motivating you. It's a negative thing that's motivating you to change. So either way, whatever way you look at it, as long as you're exercising, it doesn't matter. So some people are more motivated by positive things, others by negative things. What motivates you is important. So determine why you want to exercise. and then take that and make it work. So the main thing is starting the workout program is difficult. But most people, or very little people, actually regret or feel bad after a workout. You might be sore the day after or whatever, and that might be a negative thing, but you always feel better when you actually make your body work and you sweat, you relieve stress, depression, all these things. Exercise trumps every single type of medication or drug therapy. It's what our body needs. So it's very important to get going, and then as you kind of get addicted to this stuff, as you feel better and better about yourself, the way you're looking, the way you're feeling, it keeps you more in line with staying motivated to keep going. Okay? Okay, so the next topic will be breathing. Most people do not breathe properly. They're kind of stress breathers. They don't take in a lot of oxygen. When you're exercising, your requirement for oxygen is much higher. So you need to be breathing or focusing on your breathing much more than you would if you're sitting at your desk or doing everyday activities. So the main thing is you want to breathe deeply when you're exercising. So your repetitions, let's say it's a curl or extension, those things, your breathing should kind of mimic those body movements, all right? So you want to be strengthening your respiratory system. So there's muscles that actually expand our rib cage. Our lungs actually are not, there's no muscles in our lungs. Our lungs are just basically oxygen sacs. So as our rib cage expands or our diaphragm pulls out, it's actually reducing the pressure in our lungs, which then pulls in air. We take oxygen out of that and release carbon dioxide. So the main thing is when you're exercising, you need to try to focus on that same approach with your repetitions. And typically you want to exhale as you're exerting force. So if you're pushing hard against something, you want to be exhaling. You never want to hold your breath, and we'll talk about that in a second. As you return, you want to be inhaling. Exhale as you exert, inhale and return. So if you're pushing, you're exerting. If you're pulling, you're exerting. So you're exhaling in both of those movements. On the return to the starting position is where you would actually inhale. But inhale deep, get as much of that air in as possible because your body requires more and more oxygen. Your heart rate is determined by how much oxygen your body currently needs. So when you're exercising, your heart rate's going to be elevated because it's pumping more and more of that oxygen around your body to get to the muscles that require it. So be very focused on inhaling and exhaling during movements. If you hold your breath, that actually increases your blood pressure, you can get dizzy, and your heart rate's going to spike because you're not getting a flow of air into your lungs to pull the oxygen out. All right? Now if we look at breathing in and out, you want to be breathing in through your nose and out through your mouth. Now if you're doing something that's high intensity, something's going to switch. What's going to switch is that you can no longer inhale enough oxygen or air through your nose, and you're going to have to breathe out through your mouth, in and out through your mouth. So this would happen, let's say you're at an office building, you have to climb a couple sets of stairs. You're going to be huffing, right? You're going to be breathing in and out through your mouth. That's what's basically happening there is your body cannot get enough air into your body and oxygen, so now it's trying to suck in more and more through your mouth. You're inhaling and exhaling through the same path, and you're going to get winded faster, so you're going to have to rest more, right? So your heart rate skyrockets, you're having to breathe in and out through your mouth, which is normal, right? It's not that you're necessarily super, unfit or anything like that. Some of us are, some of us aren't, but really it's more a matter of your body needs more oxygen. So it cuts off breathing in through your nose, and now you're breathing in and out through your mouth. So that's another, again, that anaerobic threshold is another way to tell if you're doing activity or exercise. Activity, if you go out for a walk and you're talking to a friend who can breathe through your nose, that's activity. Exercise is where you have to breathe through your mouth. So doing these workouts, you're going to have to breathe in and out through your mouth because you're going to be a bit winded. But that's drastically improving your cardiovascular strength, your endurance, and conditioning as well. Okay, so warming up, you want to be warmed up for about 5 to 10 minutes of consistent low impact activity. Could be a walk outside, Could be just moving around. If you have any type of exercise equipment, you could be on a bike or elliptical or treadmill, anything like that. You just don't want to get up from sitting down and just jump into exercise. You want to warm your body up, get everything moving, which is going to increase your body temperature, your heart rate, respiration rate, and perspiration rate. Ready and prepared for what you're about to do. Most people do not do this. Even seasoned exercisers, they go into a gym, they drive there in their car, they get out of their car, walk in, they just go right at it. Not the best thing for most people. And that's the easiest way to pull things, have all types of strains and sprains. You want to warm your body up, get it ready, especially in the winter. You don't want to just jump into something cold. So those are things you want to really address and look at when it comes to warming up your body in preparation for what you're going to be doing. You're going to need more oxygen. Your body's going to have to be warmer. Your muscles stretch when they're warm. If they're cold, they tear and they pull. Your respiration rate, again, you're breathing deeper. You're focusing on your breathing as you're warming up. On a daily basis, sitting at a desk, you're not really thinking about breathing. You're breathing to stay alive, but you're not breathing enough to do an exercise or activity. You can't just jump up and jump into that. Your perspiration rate is going to increase. You're going to start sweating a bit. Okay, so when your body, we start to get that light sweat, that's an indication your body is ready to exercise. All right, so that's a good marker, indicator that your body is ready to go. Now, there's two programs I've included in this, which are post-exercise stretching. In the previous discussions, I talked about not doing static holding stretches, especially if you're not warmed up. These two programs, there's a short program and a long program, which would be done after. So post-exercise, that would be focused on lengthening the muscles, helping to improve recovery, especially because when we're exercising, you're actually doing micro trauma or damage to the muscle fibers. So this actually helps kind of get some of those waste products out and helps us recover a little bit better. Some of the keys with stretching is, especially static stretching, is number one, you never want to induce pain. You never want to push your muscle to the point where they're painful. You see this a lot with people trying to stretch their hamstrings. If someone is trying to stretch, or you're trying to stretch your hamstring and it's really painful, what that's going to do is it's going to send a signal of pain to your nervous system, which is going to make that muscle fight it and lock up. So it's not going to lengthen and stretch, it's going to do the opposite. It's going to fire and hold tight, which is not going to help. It's going to do the opposite. So number one, do not increase pain when you're stretching. Pain is going to do the opposite. Number two, focusing on your breathing. Same thing with exercise. If you hold your breath, that's going to make everything tense up. All right? So you want to be relaxing while you're stretching, breathing in and out. And with a stretch, you'll start to feel a certain point where the muscle starts to relax. That's where you can push it a little bit more and extend it. Not to the point of pain, but the point to where it kind of releases and relaxes, and now you can go a little bit further. Okay? So be careful that you don't stretch too far. There's a lot of things out there with dancers and yoga people doing these ridiculously crazy flexibility things. And in essence, what that's actually doing is it's creating instability in the joint. It's kind of stretching out that soft tissue to the point where it's not as structurally sound. So be careful not to overstretch. There's a lot of problems when you have too much mobility. You want stability and mobility, but not too much either way. You don't want to be too tight or too loose. You want to be somewhere in the middle, all right? Especially when it comes to hamstrings and quads and all these crazy things that people do stretching-wise. A lot of those people have more problems after that because they're less stable. Their joints will not hold as well. So be aware of that as you're stretching. Don't go too far. Now, the last slide here is about safety. So the main thing is exercise is going to be challenging for your body, right? It's a workout. So there are certain things you should speak with your doctor about prior to doing any exercise routine. These routines I've created are pretty basic. There's nothing extreme, no ballistic jumping and plyometrics and things like that. Those do have their benefit for certain areas, but for the most part, this is just general fitness type approaches where you're doing cardio and resistance at the same time, kind of what's called conditioning, okay? So things you would want to talk to your doctor about would be if you have heart disease. Definitely want to make sure your doctor's aware of that. they might want you to wear a heart rate monitor or monitor your heart rate and not go over a certain level. Okay, if you have a pacemaker, especially talk to your doctor, because that might be issues with a heart rate monitor and a pacemaker. If you have type 1 or 2 diabetes, that's one thing as well. You don't want your blood sugar to drop too low or go too high. So those are things to look at when it comes to blood sugar. If you have kidney disease, as you exercise, that's speeding up waste products in your body. So be aware of that and talk with your doctor. If you have arthritis, certain types of exercise benefit arthritis. Other types might create more issues. Okay, so be aware of that. If you're being treated for cancer, having any new drug therapies, be careful of that stuff and talk to your doctor about that. Another person you can talk to about interactions with medications would be your pharmacist. They know a ton about potential contraindications for drugs or drug therapies. If you have high blood pressure, again, we talked about not holding your breath. If you do have high blood pressure, you definitely want to focus on your breathing and not overexert yourself. Especially do not hold your breath. Those are things that will drastically increase your blood pressure. They will also increase your heart rate at the same time and put a lot of stress on your cardiovascular system. So be aware of this stuff and be careful and just be safe as you exercise. Again, the things here are not going to be, crazy hard. It's just going to be good stuff that will help you just accomplish daily tasks. Okay, thank you for listening. The next couple of videos will be focused on specific components that I'll break down, and this is the one you want to start with, so it's more the guidelines before you jump into these other programs. Thank you.